And the look in his eyes, I never saw anything like it. He was looking at me like I was an alien, number one. And I was good friends with the guy, and he loved me, and I was about to sign the contract and be one of his guys. And Vinny, you're ambidextrous, you got small hands, you're hardworking, all you care about is surgery. Well, that was part of the problem. But having said that, but you know what it was? And I talked about, years later, I talked to him about this. He wasn't looking at me like that. He was actually scared, and he said he was scared for himself. And he said to me, there but for the grace of God went I. Because I reminded him of a young him. And this guy became a chairman of a, pediatric cardiovascular program. And he said he couldn't look me really in the eye with the looks he used to look at me because he was sad, number one. And he said that could be any of us. We're all at risk. Now, many of you don't know this, but I have a classification system named after me. It was hard getting a name after me with the name Blood, because blood and this topic don't go well together, but I persisted, and we'll talk about that later. But mental health risk. There are different classifications of risk, but we're all at risk. Remember that. Nobody goes through this unscathed. Some may think so, but trust me. We each have our cross to bear, and that's what we need to do. But this is what is good. So the barriers: stigma, self-stigma, surgical personality. I'm here to help. The irony of being the savior and not being able to save myself. What are my patients going to think? What are my family members going to think? What are my colleagues going to think? Am I a failure? What do we look at as success and failure? Is me getting sick a failure? I struggle with this today. Trust me, this doesn't go away. Anonymity, that's a big one. Is it really anonymous? That's important. And when you establish a program, that needs to be 100% or it doesn't work. And if you need time to get out and get help, then you need to be able to be given the time. Now, does that work? And Dr. Khan, I'm looking at Dr. Khan, does that work when you have so much work to do with limited power, with manpower? Not so easy. So I'm not saying any of these solutions are easy, but they have to be addressed because it's not worth one person's life. And look, if it's a matter of, let me just say this, if it's a matter of, Vinny, it was nice knowing you, you need to get some help, but we have to find someone for you, goodbye. Rather than hurting myself, guess what? I'm taking the next train out of here. Punitive retaliation, that never occurs. It's real. It has to stop. And the only ones that can stop it are ourselves. Defense mechanisms, we want to intellectualize, we'll ask questions, we'll study, we'll look at statistics, and we'll call things burnout, we'll say resilience, well-being, all these things, whatever. And we let people down, we feel like we let people. That's just some of the barriers. Source control, I call this. Now, I like to speak in terms that we understand. So, if you treat someone with antibiotics and pressures for pancreatitis and they have a necrotic infected pancreas, you're not going to cure that patient. Well, if you get insight and get help and get therapy, but don't change the environment, the source control, you're also not going to get better. Sleep deprivation. Now, I'm not sure if it's to say this, but yeah, in the spy world, the first thing you do is you try to deprive someone's sleep. That's how you interrogate someone. Did sleep deprivation occur back in the good old days? Absolutely. Our trauma call was 72 hours on, and if people say, oh, but Vinny, you slept. No, we didn't. We operated and we took care of patients. It was 72 hours on and 24 hours off, and the big treat you got for that 24 hours were you could select any case on the operating schedule and get to do it. So guys like me stayed, got home at 10, 11 o'clock that night, and went back the next day for 3 days. My roommate, who's a plastic surgeon up in Chappaqua, was much smarter than me and said, Vinny, what are you doing? I'm like, well, there's opportunity to do this and that. And he said, I just have one thing to tell you. The more you stay, the more you stay. And those words at the time didn't hit me because I had no insight. Now I have great insight. Unfortunately, 20 years too late, 30 years too late. But anyway, Sam was trying to help me. Food and water deprivation. Sounds extreme, right? These sound like human right violations, correct? They are. We didn't have to. I lost 65 pounds, and I'm not a big guy. I boxed at I would be considered, I guess, a featherweight if I continued, which is about 140 pounds. And I walked around at about 165, and we'd suck weight down to like 145, 140. Same thing with wrestling, but I'm a small guy. Now, I'm going to show you a picture of me before you knew me, which is a little different. But losing 65 pounds in a general surgical residency over 7 years is not good for the immune system. I actually had a tooth abscess, which I waited 2 weeks to get help before my friend Sam, the plastic surgeon, had. Might be something to say about plastic surgeons, very smart people. He basically dragged me by I remember him like forcing me to go see the dental clinic, and the guy looked at me and said, shock, and he said, I've only seen this in homeless people. And I said, holy shit, what am I doing to myself? And Sam said, you see, you gotta eat. I'm like, oh my God. So anyway, Dr. Policastro, immunity is nutrition is important for immunity, trust me. So they treated that day they drained the abscess and I went back to work. So everything worked out okay. Intimidation, what was I intimidated? Personally, people don't intimidate me, I don't fear anything. But I saw intimidation, and that's on us. Environment of fear. People were afraid to talk sometimes. Reality, it's just the way it was. And as I go through this list, this is not to belittle any surgeon in the past. We were doing what we were taught, I believe. The people who trained me and the people that I trained, we were doing what was passed down on us. Very few were doing it to be what I would call, and I coined this term in my book, the toxic doctor. That's a person who does it for abuse, and that's a small percentage of a percentage. Most were just doing it because that's the way they were taught, and that's the way they thought it was done. So this is not to blame anybody. The toxic doctor, I have a way to handle him or her, not her, excuse me, a way to handle him, and that's best done outside the hospital. Attacks, both psychological and physical. I saw physical attacks. I mean, this is, again, sorry for being honest. In the locker room, I remember it was a long night, big transplant case, and probably the most inept transplant surgeon I ever met in my life, to remain nameless. I'll never forget, I walk into the locker room, and he's got a resident, intern, up against the wall, physically grabbing the kid. And I was just come out of my research, and I was like a 4th or 5th year. So I said, Dr. X, what the hell are you doing? Blood, stay out of it. You're always a troublemaker. I said, yeah, I am a troublemaker. So I guess he didn't know my boxing, wrestling, and UFC fighting history, but I got between them and I got the kid, I'll never forget this, the kid was whiter than I am, and shocked. I stood in between them, and then Dr. X made the big mistake of taking a swipe at me, so I basically, enough. I got in a lot of trouble the next day, as did he. Thankfully my chairman was a gentleman and believed me, but that can't happen, and it did. Things are much better now, and that we deserve credit for that. As much as I would like to say things were bad then, we deserve credit for the changes that have been made. All right, enough about the source control. I think I'm gonna get myself in trouble. And the control, right? So who are the people that like to control people? They're the people that are maybe not the most confident in themselves. It's called projection. It's been studied. You have control over someone. You have to treat someone as if that was your son, as if that was you, that was your brother or a family member. So those are some of the barriers, but let's continue forward. So I'll speed along here. We have about 8 minutes left. This is Dr. Pam Weibel I talked about. She took a lot of crap for having to come out, and she actually had the nerve to ask, why are we dying at such a high rate? And she quoted as saying, we give so much to preserve life at all costs while secretly plotting our own deaths. How about instead of worrying about, did you duty hours? Did you make the 81-hour limit? What the hell happened? How about asking, do any of your residents feel depressed? Do any of your surgeons feel depressed? Did any of them ever get help? Those are the questions. Not whether someone went 2 hours over their freaking 80-hour work week. And my friend Sam, the very smart plastic surgeon, once said to me, Vinny, you know how many hours we've worked the last 7 years? I said, no, Sam, how many? 137.4 per week. So immediately I said, 24 times 7. I said, holy, really? Oh, all right, that's good. And I thought, really? Wow, that's pretty good. And he's like, what do you mean it's good? You crazy? Get off the train. And he said, my problem was I never got off the train. And he got off the train, became a plastic surgeon, and he's doing very well up in Chappaqua, Mount Kisco. Anyway, it is what it is. But this woman basically started a registry. She's collected now over 1,300 documented cases of physician suicide from patients' families and from attempts from survivors. She takes letters. She has a hotline. First was a whistleblower. Eventually made it to the Mehmet Oz show, which I think is a big accomplishment. If I ever did that, I'd feel, well, I can see Dr. Carol Moore's not a big fan, but she was on the show, and the title of this show, of this segment, was Doctors Who Snap. Now the good news, it was on TV. The bad news is Doctors Who Snapped. I mean, really? That's what we're going to call it? Anyway, so she took a lot of crap. She has a hotline. She's trying to get some numbers out there. And this is one of her books. These are actually, that's a real person who wrote this on this book after reading this book and then died by suicide. So Father Bernard Blood, that's my Uncle Benny. He's the guy who I rounded with when I was a kid. He was a missionary in Africa, Haiti, Nicaragua, and many other places. And then when they came back, they became chaplains at Catholic hospitals on Long Island. And he used to take me on his rounds, and we gave, it was a little, you might think I'm a morbid guy, and no wonder you got depressed, Benny. But he took me on rounds, and he taught me how to talk to people. And he was a great communicator. He taught me several things. One was to never forget someone's name and always to call them by their name. The second was to always touch them. And the third was to never leave them without hope. And he always said to me, because he said, he always wanted to be a doctor, Uncle Benny, but his order, the Montfort Fathers, wouldn't let him. Some of the more progressive orders do let them study and become doctors. His wouldn't. So he kind of lived a little bit vicariously through me. He always asked me a question, what's it like? Are all the doctors smart? I said, no. What do you mean by that? No, I met a lot of idiots. Okay. And I realized I was hurting his feelings, and I stopped that. Are they all caring and nice? No. Most are, but not all, Uncle Benny. No, they're not. And then he said to me, you know, Vincent, this sounds like a tough situation you're in. And he had these words for me. He said, in the end, we're all just people doing the best we can with what we have. And I think that's true. And that's where we must go forward with that kind of humility and forgiveness of ourselves, and do what we need to do to make things better. Quickly, we came in second place in the suicide rate. The most at risk, and this is real data, this is the data collected by Weibel and others. These are actual, truly, deaths by suicide. Male anesthesiologists have the highest rate, 5.5 times higher than surgeons, who are number 2. So we got second place. Silver medal, not bad. But they have access, they have means. So Dr. Susan, we have means, we have knowledge, we know how to do it, we don't get help. We're a different population, that's one of the take-home messages of today's talk. However, if you go by overall numbers, first place, and this surprised me, but even when they compare professions, the military, which you would think, you know, life and death and some horrible stuff, which I'd rather not belabor on, you would think that'd be higher. Now, that does not take into account vets who come back with post-traumatic stress disorder, but surgeons, you know, and it's a numbers thing too, but, you know, the fact that we're even mentioned in the same breath is stunning and amazing, and we just have to remember that these are names. And just quickly, one story about one other doctor, and then we'll move on. Ben Schaefer, orthopedic surgeon, Washington, D.C., died by suicide at the age of 57. He was a team doctor for the Washington